Caring for someone with delirium. Delirium is a serious and distressing condition which causes a sudden change in how a person thinks and behaves. It is a sign the person is physically unwell. This video explains how to recognize delirium and ways to treat it. How common is delirium? Delirium is common in people with terminal illnesses like advanced cancer or dementia. It affects up to 20% of adults admitted to hospital and 35% of those admitted to hospices. Delirium becomes more common as people approach the end of life. What are the symptoms of delirium? Delirium usually starts suddenly over a few hours or days. Symptoms of delirium may come and go and sometimes get worse at night. Delirium may cause a person to feel confused. They may not know where they are or recognize the people around them. They may have difficulty talking. They may say or do things that are out of character. They may experience auditory or visual hallucinations or think that people are trying to harm them. This can make them fearful of the people trying to care for them. There are 3 types of delirium: hyperactive, hypoactive, and mixed delirium. Hyperactive delirium is when the person is restless and agitated. Hypoactive delirium is when the person seems withdrawn, slowed up or drowsy. A person with mixed delirium has symptoms which fluctuate between hyperactive and hypoactive delirium. What causes delirium? Delirium may be caused by medical conditions such as being dehydrated, having an infection, having poorly controlled pain, or being constipated. Liver or renal failure and metabolic imbalances like hypercalcemia are other causes. Delirium may develop after surgery or be related to medicines, especially sedatives or strong analgesics. Withdrawal from medicines and alcohol may also cause delirium. Unfortunately, delirium often gets missed or is recognized late. Hypoactive delirium is sometimes mistaken for the person being depressed, having dementia, or being very tired. Identifying delirium. Identifying delirium early is important as it increases the chance of the person getting better and helps us provide better care. If you are concerned about a recent change in how a person thinks and behaves, consider delirium as a cause. Delirium detection tools can be used as they help healthcare staff to identify delirium, more than using clinical judgment alone. The 4AT, or 4A's test, is a quick and easy test for delirium. It can be used by healthcare professionals when delirium is suspected, or routinely to screen or check for delirium when people move to a new place of care, such as a hospital, hospice, or care home. The 4A's stand for the 4 items that are tested: alertness, abbreviated mental test 4, attention, and acute change. Alertness is seeing if the person is drowsy, sleepy, or agitated. The abbreviated mental test 4 asks the person their age, date of birth, where they are now, and the current year. Attention is tested by asking the person to list the months of the year in backwards order. For acute change or fluctuating cause, consider any significant changes in their mental function that have arisen over the past 2 weeks and are still present in the last 24 hours. If the person is unable to tell you, ask those who know them best, like family, friends, or carers. The 4AT takes just a few minutes to complete and can be used to test all patients, even those too sleepy or agitated to answer questions. No special training is needed to use the 4AT, but it's helpful to have some knowledge about delirium. If you want more information, visit the 4AT website. The link is at the end of this video, or ask a senior colleague for advice. If delirium is suspected, Use the term delirium or possible delirium rather than non-specific words like confusion. This helps share understanding with others and will improve the person's care. Treating delirium. Delirium usually improves if we can find and treat the underlying causes. For example, giving antibiotics for an infection, encouraging the person to drink more fluids if dehydrated, or reviewing their medication if that is considered the trigger. Ensuring a calm and supportive environment is also important in caring for the person. Here are some ways that families and healthcare staff can help. Talk in simple sentences about familiar things. Remind them where they are and what is happening around them. If they find it difficult to talk, ask simple questions where they can give yes or no answers. Consider asking, "Do you feel frightened?" or "Are you in pain?" If the person is distressed, try to find out and address what's causing this. Let them know they are okay, especially if they seem worried. If they believe things that are not true, be kind and reassuring. If they think somebody is trying to harm them, let them know they are safe. Gentle touch can be calming. Have a clock nearby so they can see the time. Use familiar photos or favourite items to help engage with the person. Listening to familiar music or sounds may also be helpful, but avoid loud noises and too many visitors. Help them to drink and eat. Make sure they are wearing their glasses and hearing aids if they need them. Ensure they have access to an interpreter if required. Support them to remain active. Help them to sit up or move around if they can safely. Offer to take them near a window to get some natural daylight if they can't go outside. A good sleep routine is also important. Avoid giving drinks with caffeine after lunchtime, as caffeine blocks the sleep-inducing chemical in the brain. Offer decaffeinated drinks instead to help the person sleep better. Ensure it is quiet and the lighting is dimmed at night. We know it can be worrying to see someone with delirium, so remember to explain what's happening to those close to the person and offer them support. Medicines such as benzodiazepines and antipsychotics can be used to treat delirium, but only if the person is distressed and other strategies have not helped. This is because these medicines can worsen delirium and cause other adverse effects. If these medicines are required, it is recommended to use the lowest dose for the shortest time. Delirium usually gets better if the underlying causes are treated. Recovery may take a few days, but can take longer. However, if the person is approaching the end of their life, they may not recover from their delirium. In this case, care should focus on the person's comfort. People with delirium in the last hours or days of life are usually sleepy and drowsy. Occasionally, the person may become agitated and distressed. They may call out in a confused way and be restless and fidgety. This is sometimes called terminal agitation. Medicines may be needed to ensure the person remains calm and comfortable as they are dying. Key messages. Delirium is a serious condition, but there are ways we can help. Key points to remember are: use the 4AT to help detect delirium. Find and treat reversible causes of the delirium. Find ways to help the person feel calm and safe. Only use benzodiazepines and antipsychotics to treat distress when other ways have not helped. Offer support to those close to the person and show how they can help. If you want to find out more about delirium, here are some useful resources. You can get more information about the 4AT at www.the4at.com. And you can also find information in the Marie Curie Palliative Care Knowledge Zone, Information for Professionals, at www.mariecurie.org.uk, or scan the QR code.